Okay, guys, so the other video got cut off. That's okay. Where I'm going to, one, attempt to splice them together, but if not, this will be part two of part two. So what I was saying when I got cut off was about patients going out on appointments. You want to know what they went out on an appointment for. So if maybe they went and got their eyes dilated, and this is a person who is ambulatory, which means up and walking around. It's a good idea to know that maybe when they come back from having their eyes dilated or, whatever the situation is, but specifically that, maybe they're going to have a little issue seeing, right? Which puts them at a risk for a fall. Why not prevent that fall? One, it's the best thing for the patient, but two, it's less work for you. And if the staff all know that this patient went out to an appointment for this reason, especially again upon them returning, or maybe a family member called while they were out. There's nothing worse, honestly, as a family member who've had loved ones in nursing homes, to have that nurse say, oh, well, I don't know, they went out for something. But you don't have any information to give to the person who we're supposed to be giving the information to. It's frustrating. It can be a little scary, especially if there's been something going on. And please stop telling people, whether it's the provider, the families, the lab, or whatever, well, I don't usually work with this patient. Because we all know in nursing, once you take the keys, you've worked with that patient. So that's why you always want to prepare. So I want to continue on in this video since we got kind of cut short on the last one. While these patients are, in your care, meaning you've got the keys, you've accepted report, whether you were late, whether you were on time, whether you came earlier, came late, or whatever. A lot of our job, guys, as nurses and in nursing is educating the patient. We see it all the time where this patient that's on dialysis and they're diabetic, what does the family do? They bring them all of these Cheetos, caramel cakes, 2 liters of soda, all kinds of snacks and things that really are just killing them, helping to kill them, right? So even though we know you could tell a person 50,000 times these are adults, so they're ultimately going to do what they're going to do. But it's not going to hurt to still educate them. Sometimes it's about educating the people who are bringing the things. And they may still not care, but you've educated them. And this is also where you can take 5 seconds out to just document that you provided that education. Because we also have to think, guys, as far as litigation. Because one, we're in a sue-happy society, and some of it is warranted, but some of it is not. Some of it is people setting you up for these things, right? And especially in nursing homes, because we've all seen them, and they used to kind of be at night, in the middle of the night. Now they just run the commercials all day long. Do you have a family or a loved one in a nursing home that got a wound, that had a fall, that had anything negative that they can find to say? When what are we taught on our side? People have a right to refuse. They have a right to fall. They have a right to all of these things. But then for these things that are their rights, then they turn around and they sue. But this is the world that we live in. And so protecting ourselves. But if you are not prepared to perform, essentially, if you're not also being efficient, which was the word for the last video, right? Efficient. So now we also want to make sure that we're prioritizing. If I have to choose between a patient that is, maybe stable, but, I don't want to say complaining, but verbalizing aggressively their concerns over a patient who I know is more of a little brittle diabetic, I need to go and tend to that person. I know the saying is the squeaky oil gets the wheel. However, this patient here, the diabetic, that needs a little more attention, they've got to be the priority, guys, because by the time you get to them, it may have gone too far to get them back, right? So whether that means them going out to the hospital or just having, an unfortunate event with a low blood sugar or things like that. So, and that's where it's difficult in navigating in these nursing homes a lot of times, guys, because what has happened from it being a nursing home to rehab facility? Well, they've taken that word rehab a little bit too serious. And literally, we have people that are rehabbing from drugs, alcohol, in these same facilities that you got 98-year-old granny in, right? So that's again why you have to be prepared at all times as the nurse and knowing what's happening and what's going on. And talking to your staff, talking to the patients. You know, you have a lot of patients that are in nursing homes today that's more due to homelessness and lack of community resources than you do, well, I'm not going to say more, but I'm going to say there's a lot there. So some of those patients, even educating them, because they may have a roommate, right? And you don't, there's HIPAA laws and HIPAA violations. So of course we don't want to share that type of information, but general education has got to be at the forefront of us as nurses. That's what sets us apart from the medical model, and making sure that we are educating, not only ourselves, our coworkers, but our patients and their families. So that bedside nursing care, that's what people look for. You know, you get a lot of stories of how patients, when they were in the hospital and they may have been having delirium, but what did they remember? The kindness of that nurse and that touch, right? Those physical touches, those kind words, or just an understanding, empathizing. That's us. That's what we do as nurses, guys. So that's another step. Like I said, empathizing. Now, when you have a patient that, yeah, we know that sometimes you're going to have patients that are medication seeking or attention seeking. And we're going to talk about that in another video later. But again, that prioritization, because now that's what we've got to do. We've got to prioritize what's going to happen. Now, if patients are refusing medications, I kind of want to get into this a little bit in this video. If they are refusing medications, we need to document that, because it does no good for you to call me when a surveyor is in the building to say, I've got a patient, you know, remember, they've been refusing. Well, no, I don't know, because I'm not in the facility and you have not documented anything. So that is something that you need to document and then also share. You know, if this is a patient's behavior, we need to get psych services and social services involved. That is what they're there for, right? This is a collaborative team effort that we've got to all work together on, guys. And, you know, there's no big I's and little U's. However, we need every part of the team to get in on this and do their part. So, in that prioritization, it may be a patient who you know that they smoke, so educating them that, hey, when you go out to smoke, you need to come directly here to get this inhaler, right? Because what do? They're relaxed now because the cigarette has calmed them down, but they already were having a little shortness of breath or just difficulty breathing, a lot of congestion, coughing, whatever, and they go and they lay down, which does what? Makes it harder for them to breathe. So now you've got more issues, right? So, or panic attack, anxiety, a lot of those things. Guys, preparing and making sure you're working efficiently. And this is not something that happens overnight. It comes with practice. But we're talking about navigating and being prepared, right? Preparing to perform, working efficiently, okay? So, and then prioritizing. We've talked about that. Prioritizing. For me, I always like to call my labs in early in the morning, like right before I get started with my med pass. So that way, as the providers start calling back, I've already got in my mind what needs to be done. I can do my follow-ups. And usually if I'm out with the patient, I can then educate the patient on what the provider has now ordered for them based on what this result was. So kind of killing two birds with one stone, right? Don't get me, Peter. I don't literally mean killing birds, but you know what I mean. So I think, let's see, the next thing I would say is in prioritizing, also making sure of who needs to know what when they need to know it. Because I find a lot of nurses now, they're waiting to the end of the shift and trying to dump all of these labs or dump. I had 2 falls a day. I had a patient expire. I had a patient go out to the hospital. I got a new admission. And they wait until the end of the shift to call the provider to relay these things. Well, then if I, as the provider, don't answer, then they still enter in a note that says that they related to me, although they never spoke to me. They never got a response from me, because the truth is, guys, with all the technology we have, there are times I'm in facilities and I don't even know you called. I don't know you've texted. I don't know that you've left a message until after I leave the facility. Heck, now with T-Mobile, there's times where I don't know till 2 days later, and I just randomly get this message that pops up. So if you don't hear back, you did not relay anything until you get a response. So please stop doing that too. That's another thing, that false documentation. Don't document that you relayed something when you didn't. So I think we're going to cut this video here, and I'll start up another video. So I guess that's going to be, part 4, because this has been part 3. Okay, so part 3, we'll call that prioritizing. Okay, thanks.